We head back to the country director of the World Food Programme right here in Rwanda, Edith Heines, who will be telling us some of the concerns, or rather the effects of COVID-19 when it comes to the food delivery and how it will be in this crisis. Thank you very much, Edith, and of course we apologize for the technical hitch.
Good evening. Let me first check if you can hear me.
Yes, we can hear you loud and clear. So the World Food Programme estimates the number of people that will be facing at least food insecurity, that it could double this year to at least 265 million. You know, this is a very huge number. What is the implication on this?
Indeed, as the WFP Executive Director mentioned in his address to the Security Council last week, the world is not only grappling with the COVID-19 global health pandemic, but on top of that, we're also on the brink of a hunger pandemic. And you already mentioned the global report on food crisis, which mentions that already 821 million people go to bed hungry every night in the world. And further, there's 135 million who are on the brink of starvation even before the COVID-19 crisis. And now with the COVID, it's estimated that another 130 million people will be pushed on the brink of starvation by the end of 2020. What does that mean for East Africa and the Horn of Africa? WFP estimates that there are already 20 million people who go to bed hungry every night, with projections that this could increase to between 34 to 43 million in the next 3 months due to the socioeconomic impact of COVID-19. Therefore, if we would reach that 43 million number, that would be more than doubling the number of food insecure people in this region.
Absolutely.
In Rwanda,
sure.
Yeah, go ahead.
I was just going to ask you then how, the pandemic, how will it cripple the delivery, of aid services in countries that we already know that are suffering from malnutrition and starvation and food insecurity just in general?
For WFP, we don't feel yet that COVID-19 is crippling the delivery of aid, though greater number of people in need of food assistance means more than ever that governments in the region must keep the borders open and the trade flowing and avoid at all costs protectionist responses. Only through regional and global partnership can commercial trade and humanitarian goods continue flowing across the borders, and they are the lifeline of the global food systems as well as the global economy. And in Rwanda, where 65% of the food consumed by the household is purchased in the market, this indicates a very high dependency of Rwandan households on functioning markets and a continued flow of trade and goods, both needed within Rwanda but also within the region. And we have already seen, because of the measures taken to combat COVID-19, that there have been fluctuations of food prices of basic food commodities. So it's really an indication for the governments in the region to work together and ensure that there is a continued flow of goods and food in the market.
But let's look at it in a way, or rather the perspective of when the COVID pandemic continues, in African continent. We know that it's not as huge compared to other continents across the world. But in Africa specifically, we are seeing people who are trying to save as much food, as they can. What can we anticipate when it comes to food insecurity to people who cannot afford to go to the market, just like you've mentioned?
There is, of course, we already mentioned the possibly doubling of the food insecurity for people in the market, for people in the region. And also in Rwanda, we know that even before the COVID-19, 18.7% of the population was food insecure. And these are mostly the poorest and very often people dependent on unskilled daily labor, and including smallholder farmers. And although the government has already put in place measures to make sure that agricultural activities can continue, there's still many challenges that affect the livelihoods of these vulnerable people. And on top of that, we now also have new vulnerable people, new groups that have become vulnerable that weren't vulnerable before. And these are mostly due to loss of job opportunities, loss of income. So the potential impact is that because of this crisis, there might be more people dying of the socio-economic impact of the COVID-19 crisis than the virus itself. And therefore, it's really critical that we come together as a world, as a united global community, to make sure that not only we fight the disease, but we also protect the most vulnerable and from these effects of the crisis. And that's why it's very important to work on strengthening national safety net programs and social protection systems, which then ensures that people have access to assistance, but it also helps maintain peace, and it prevents tensions that might arise because of these pressures in the communities.
Maybe before I let you go quickly, do you think as the African continent, should we be worried? Should we be scared? Where do we stand right now in terms of numbers?
Well, we already see that there's a big impact for Africa, and WHO and WFP do expect that Africa will be hard hit. Now, what will be the actual numbers? What will be the ultimate impact of the food security in these different countries and in Africa? It's not sure, and it's up to us. It's up to us, the UN, the governments, the business communities, international banks, because of our actions today, we can also help determine what the future will be. And there are things that we can do to lessen the impact, and that's providing assistance programs, especially focusing on those vulnerable and poor people. And so, as I mentioned, social protection schemes are very important now, but also resilience building activities are very crucial for the future of the countries.
Well, thank you very much, Edith, for making time to be with us.
Thank you.
Of course, I was speaking to the country director of the World Food Programme here in Rwanda. She was telling us some of the measures that are in place and what we as a continent can look forward to in terms of world food crisis.